What would you assume is the priority of a hospital?
Well, hopefully, a place where people can go to get well.
That's right. Take good care of their patients.
That's right.
But it does seem that there are too many conflicts of interest when it comes to the financial end of things. And a new study shows that U.S. hospitals may have a financial incentive to not implement techniques that reduce surgery-related complications. In other words, hospitals make money off of your complications. There's something wrong with this picture.
Well, there we go again. I mean, medicine today is a business more than it is a service. Now, I don't think we should just indict hospitals and say they want people to get sick and have complications. And some hospitals just simply don't have the facilities or the techniques to be able to handle problems that others can.
But you know, when you really think about it, like if it were something else, like say you went to the store and something went wrong with the product, you could take it back and they would be responsible for either, you know, repairing it or giving you a new product.
Yeah, well,
so doesn't it seem ethical that if you got a complication that was avoidable in the hospital, that the hospital would take responsibility for it?
well, it would make sense. I mean, look
Why
at
do
the
we have to pay for what they did?
Well, I mean, look at the hand washing problem we have in the hospital. We know that the staff doesn't, even doctors don't wash their hands unless there's a TV monitor there that's recording whether or not they wash their hands.
And we also know that if they put copper in, that would kill the germs.
Well, copper surfaces, okay, on things like doorknobs and trays that go to the hospital
and the
telephones.
pushers on the door.
Yeah, all those kinds of things, because copper kills microbes in just about a minute and a half. So they could really be using copper surfaces, which would cost a little bit more money for sure. But when you think of the extra cost of one hospitalization, it's made up very quickly. So money becomes the thing that becomes the biggest issue.
I'll bet most people, if they really thought about it, they know somebody that's had some sort of a complication.
Yeah, I know somebody. My own complications. That's right. Yeah, well, I think what we're looking at here is a study that was published in the Journal of the American Medical Association in April of 2013 that really says that there are about between 3 and 17% of surgeries have complications that increase costs by almost $12,000 per patient. And hospitals are not paid for they're not paid in a way where they're bundled, meaning they aren't paid a flat fee for a hip replacement or a flat fee for an appendectomy. They get paid for each service. And so the more complications there are, the more they're going to be making in terms of profits.
Well, it seems to me that the more surgeries that are successful, maybe if they had an incentive to give them a bonus or something.
Well, that would be one way. The other is just to bundle care and say, okay, you can do an appendectomy, we're going to give you $7,000. That's it. If you have a complication, it's your problem. If you don't, you get them out quicker, that's your benefit. And that's what we're moving to.
Well, how is it that hospitals are punished for the quality improvement programs?
Well, isn't that an interesting question? Because if they have fewer complications because they have quality improvement programs, then they're going to have fewer complications. If they have fewer complications,
less money.
They're going to make less money. So I don't think they have an intent of doing that. But I think when there are high complication rates, who's motivated to change all that? It would be mostly the patients, for sure, the doctors next, and it would be basically the administration last, because they have to make a hospital work financially. And if a hospital doesn't work financially, there's no hospital, and that's the problem we're running into.
Well, and yet the hospitals are claiming that they're in the red.
Well, some of them are, but you look at the average profit of a privately insured patient who doesn't have complications for a surgery, it may average something like $17,000. With a complication, it's like $56,000. For Medicare patients, it's a whole different story, though. There you're looking at $1,900 for an average cost compared to that $17,000 number for the same procedure, and maybe $3,600 if there's complications. So why is it different? Because Medicare is moving more towards bundling, and they're saying, we'll pay you this amount. You worry about whether or not you're going to be spending a whole lot of money yourself. So when hospitals are on private, on patients who are in Medicaid or are paying themselves for their health care, then it's a whole different story. They're losing money. And somehow they need to make up for the money that they're losing on those patients because they simply don't get enough paid by Medicaid. And that's a problem, Vicki, we're going to have to be dealing with as we've got this Obamacare, the Affordable Care Act, coming into effect in a big way, because we can't go on with the system we have it with the amount of financial reimbursement there is. Our hospitals are going to collapse, or we're going to wind up with hospitals that are federal hospitals like the VA system or the county hospitals that work for a much lower margin. In fact, they generally lose money.
We'll probably end up losing healthcare workers.
Well, we'll be losing a lot of things. That's exactly right.
Well, anyway, I think that we need to put Florence Nightingale back in our healthcare system.
Well, I think that would be a good start. So when we're looking at the complications we have in our hospital care system, because each hospital is different, it's worthwhile checking out the records. Okay, there are organizations that rank hospitals. You wouldn't want to have your open heart surgery in a little hospital in Podunk, Arizona. You might want to go to a major medical facility that has a very good track record. So part of our responsibility as patients, because the system isn't fair, is to do our own homework. When there are complications, the patients are the ones that suffer from it. It's us that suffer from it. And, of course, we're the ones that are paying the bill ultimately.